Good morning everybody. I am Dr. R. Mallika, Associate Professor, Department of Biochemistry, V.V. Perumal College for Women, Virudhunagar, presenting this video on Introduction to Pharmacology. As pharmacology is an integral part of medicine, it is vital to acquire some fundamental knowledge about this field. Pharmacology is derived from Greek pharmakon, means drug, and logos means study or knowledge. Understanding how a drug or a substance is likely to modify the living system is a basis for pharmacology. Based on sound understanding of principles of physiology and pathology, it is expected from medical staff to acquire more knowledge with the various systems of medicine being practiced in modern world. And we should understand some terminologies or terms used in the field of pharmacology. First, let us see about the drug. Drug is a substance used in diagnosis, prevention or treatment of disease. And a drug is derived from the French word drogue, means dry herb. According to World Health Organization, drug is any substance or product that is used to modify or explore physiological systems or pathological states for the benefit of recipient. And there is a term called as adverse drug reaction. According to World Health Organization, again, a response to a drug which is noxious or unintended, that is the response of the body towards the drug which is taken in. Adverse reaction occurs at doses normally used in man for the prophylaxis, drug diagnosis or therapy of disease. Now let us see what is called pharmacokinetics or pharmacodynamics. Both are the same. In Greek, kinesis means movement. Pharmacokinetics is the study of absorption, distribution, metabolism and excretion of drugs. That is, what the body does to the drug. What happens to the drug after it is getting entered into the human system. Pharmacovigilance, that is called as the science relating to the detection, assessment, understanding and prevention of adverse effects or any other drug-related problem. Pharmacopoeia, it is an authoritative book containing a list of medicinal drugs with their uses, preparation, dosages, formulas, storage and analysis, etc. The content of this book has to be approved by the regulatory bodies. That is called the pharmacopoeia. Then, what is clinical pharmacology? It is a subdiscipline of pharmacology dealing exclusively with the effects of drugs in humans. And what is this experimental pharmacology? It is a subdiscipline of pharmacology, again dealing with the effects of drugs in animals or cell lines or tissues. And what is therapeutics? It deals with the use of drugs in the prevention and treatment of disease. And what is chemotherapy? Chemotherapy is the use of chemicals or chemical substances used for the treatment of various infections. And then comes pharmacy. It is a science of identification, compounding and dispensing of drugs. It also covers collection, isolation, purification, synthesis and standardization of medical substances. Now we can understand what happens to the drug after getting entered into the body. First, the drug has to be absorbed by the bloodstream. After it is getting entered in the bloodstream, it has to reach the target site where the therapeutic action is required. And there it gets distributed. After rendering its therapeutic action, it has to be, the residual part of the drug has to be eliminated from the body through excretory system. This is the normal metabolism of any drug after it is getting entered into the system.